Oh my God, Neil, get in here.
At least 2 tornadoes touched down, including one that caused heavy damage near downtown Nashville.
I'd like to talk to you about the new virus that causes the disease COVID-19. Stay home as much as possible and avoid crowds.
This obviously comes at a time when Nashville wants and needs to give each other a big hug.
And it was like a boom, and then we looked outside the windows and we saw the trees moving, in like huge trees moving in a circle like that. And so we immediately jumped out of bed, and it was, I heard another loud boom, and it was just a second. We jumped into our shower, and in a second it was done, and we sort of looked up and we were outside. So that we could protect coverage for vulnerable Tennesseans. Annually, everyone has to complete forms and complete paperwork proving that they're still eligible or still qualified for coverage. I think through this whole crisis, we're sort of finding that our communities have power to protect the vulnerable people and protect our loved ones and our neighbors more than maybe we thought before.
Often when disaster strikes, it's the most vulnerable who pay the steepest price because people who are making policies just don't know. They don't know. And so, you know, a big push to like, let's close schools. Well, what happens to those children who depend on school meals? Those sorts of things are what the Justice Center has done for almost 25 years now, is basically making sure that the daily realities of low-income Tennesseans are considered when policies are made. We had to figure out how we got food to low-income folks who were hit by the tornado, how we made sure that people's health coverage was maintained, because if they had to show that they were still eligible and they didn't even have papers, because some of the papers were blown to 3 counties over, we wanted to make sure and protect those things. So we acted really quickly to basically stop anything that would harm clients and low-income folks any further than they were already harmed. How do we take this moment where everybody understands for the first time maybe ever how interconnected we all are, and use it to create policy that protects us all, both in terms of the folks we go to church with, but also the people who might be sneezing in the grocery store aisle. We want to make sure that everybody has the health coverage they need to have full lives. Healthcare, as we've always said, it's what makes us all, it's what unites us all. We're all human, we all bleed. You don't go into a hospital as a Republican or a Democrat. And this, I don't know of something that could make us feel more interconnected with each other than this pandemic. I think that many people in America assume, if you really are in need, you'll get it. The truth is, you don't. You don't get it if you really are in need. You get it if you're insured.